Hey guys, it's Dr. Anderson at Life Essentials Chiropractic in Missouri City. Guys, today I want to talk to you about what is the actual cause of disc problems, disc herniations, disc injuries, disc bulges, tears. There's a lot of names for different variations of it, but there's really two general things that cause this. One are the things you remember. It could be related to a trauma, like a car accident, something jars your spine unexpectedly. It puts abnormal pressure on the disc cushion tissue in between the spine, and it can cause it to swell or tear. And those things are related like an accident or a sports injury or a fall or something that happened to you all at once where you probably remembered it. But what I found in 17 years of treating people with disc problems is that the majority of cases happen little by little over time before the patient ever felt the fact they were becoming vulnerable to a disc being injured, and then one day it kind of blows out and they start to feel it. So how does that happen? So there's a normal anatomical structure of the spine. It holds our body's weight and gravity, like the frame of a house holds the whole weight of the house. And it has to be balanced with level foundation to sit on, and there has to be certain balance and structure to support the house, otherwise it starts to shift or crack or become damaged over time. So the spine should be straight up and down from the back. From the side like this, you have these arches, and that creates spring and cushion and shock absorption. And in between, we have these spacers, which are like connective tissue cushions called spinal discs. Those discs are actually about 70% fluid, and it's a pumping mechanism that normally get through normal motion every single day through different daily activities. The disc gets pumped through a process called imbibition, where it's sort of like a kitchen sponge that's full of fluid, and it has pores, and you can squish and pump and suck fluids in and out. You can get rid of waste products from the disc. You can bring nutrition and hydration and sustenance into the disc, and that keeps them healthy. But when you have a spinal subluxation or spinal distortion or misalignments in the spine, or fixated joints where the joints stop going through their full motion, they become fixated, then the normal pumping and hydration, the pumping mechanism of a disc can start to get less and less over time due to lack of motion of that vertebral segment. Or you could have abnormal mechanics like a shift of the spine that's creating gradual, perpetual, daily, weekly, monthly, every single day, wearing abnormally on top of that tissue. And eventually it becomes worn down and injured to the point where it has too much abnormal weight loading or abnormal wear and tear, and it can swell or tear, right? So inside that disc, what it looks like blown up is when you have normal alignment and pressure on a disc, then you have good shock absorption and cushion. And the disc is really important because it's a spacer in between these two bones that makes a place for that nerve root to go to. And that's how that nerve root communicates with every single tissue of the body and controls your body. When that subluxation or misalignment of the spine's been there for a really long time, or if there's an injury with it, that can all of a sudden start to one day make that disc start to swell up and bulge. And when that disc swells up and bulges, then it starts to rub and irritate the nerve, and sometimes it even rips, and now you have the actual gel inside the disc in the canal laying on top of the nerve as well. When that happens, that can be debilitating. It can create symptoms like sciatica. You might get pain, numbness, tingling, achiness. Some people describe it as like a toothache going down their leg, lightning bolts, burning, all sorts of different sensations, or sometimes you just get a little tingling or it keeps going to sleep. In severe cases, you might have the muscles of the arms or legs start to even weaken and shrivel up and atrophy from not enough life getting back to those tissues. So these can happen in our neck and go to our arms and hands. They can happen in our lower back and go to your legs and feet. And that's what causes the majority of disc problems. So at Life Essentials Chiropractic, we have a very unique approach where we combine two things: spinal decompression therapy that's been researched to have a 90+% success rate, actually allowing a vacuum very gently, very specifically target a specific vertebral disc segment, and you can actually create negative pressure and start to suck some of that tissue and pressure back off of the nerve naturally without drugs, shots, or surgery. And it's got about a 90% success rate at helping people recover from those disc issues. It's one of the most effective therapies or treatments that's ever been studied for disc issues, and it's all natural. But we also want to address the real root cause of why did that disc get injured anyway? Because let's say we just do some therapy exercises, or even if you got injections, or even if you had great decompression therapy, but that subluxation, that root cause, that mechanical issue is still left there. None of those things address the alignment and the range of motion and the structural balance of the spine as a whole. So we combine that with very high level spinal corrective programs to take images, and we measure where that's at, what the real root cause of the issue was months or even years earlier. And we start to over time move and train and correct that structure to now balance the mechanics, balance the pressure on the disc, and even have a more effective impact on the nerve system as a whole for overall health and wellness. And when you put those two very unique things together, that I would say less than 2% of chiropractors in the nation do both those things simultaneously at the same time, it creates an amazing outcome in the short term, but really long-term health and maintenance and recovery without worrying about down the road, maybe another disc becomes affected or another one. And now you can get back to living a life without limits.